everybody else has made some really great points. I'm personally an advocate for a single-payer healthcare system, frequently referred to as Medicare for all. But I think if we're going to do that, we also need to strengthen it, because everyone knows, that there are gaps all over the place. I've been a beneficiary of the VA healthcare system, and it has its problems. But most of those problems are due to a lack of funding, where we do not have the number of doctors and nurses we need taking care of our veterans. So I think that if we were to adequately fund our healthcare system, and I think that education reform so people can become doctors and nurses without graduating with hundreds of thousands of dollars in debt, I think that's a good step in that direction. I also think that the coverage should include dental, vision, and as was mentioned, mental health. I believe that in the richest country on the earth, when we spend so much time talking about American exceptionalism, we should take some time to actually be exceptional. We shouldn't be looking at other countries around the world and seeing far better health outcomes for a fraction of the cost. We are paying too much for low quality care, and that's something that we can fix. It's not going to be fixed tomorrow, it's not going to be fixed next year, but if we put in the hard work and we work together, we can actually make it happen. Thank you.
Thank you very much. The next question, we will start with Mr. Warren Christopher, and that question is, what is your position on introducing or supporting legislation to change, replace, or repeal the Affordable Care Act? Please explain your response.
Sure. As I really want to take just a few minutes to make sure you all understand that we're interviewing right now to be your servant leader in Congress. And this is about leadership. Make no mistake, this is about leadership. And along with leadership comes the responsibility to be able to negotiate, to build coalitions, to lead people, to lead change, and to deliver a result that you can see and feel. So when you hear people talking about going and not being able to do anything, because it's either they lack the leadership ability or they lack the experience to build coalitions and to build and to lead people. So I want to make sure that you understand that. With the Affordable Care Act, I appreciate and I honor the President for having the fortitude to fight for the Affordable Care Act. And I want to make sure that we do not in any way repeal the Affordable Care Act. What I do believe that we have to do, though, is I do believe that we have to repeal the Cadillac tax. I don't think that there should be any specific provisions for or any specific taxes on a particular entity because of what people perceive as the health care package. I also want to make sure that we continue to strengthen opportunities for women to seek services because they've been a victim of domestic violence, or to make sure that we have seniors that are getting the services that they need. Again, when it comes to dental, when it comes to high blood pressure, diabetes, colon and rectal cancer, to make sure that those services are offered without any regard to age or sex.
I believe that the Affordable Care Act, call it Obamacare, has been the greatest achievement under President Obama's leadership. And there are some challenges with the Affordable Care Act, and I think both Democrats and Republicans would recognize it, and the President would as well. The challenge has been that because the Republicans have only sought to replace and repeal, they've been unwilling to work with Democrats to fine-tune and improve the Affordable Care Act. When Social Security and Medicare were first established, or I should say Medicare and Medicaid, there were problems with that law as well, and over time they were able to fix it through legislation. We haven't been able to do that with the Affordable Care Act, so there's a lot of work left to be done. Two areas, one big, one small, that I can think of where I want to take leadership in improving the Affordable Care Act. Number one, major shortcoming of the Affordable Care Act, it does not cover undocumented immigrants, and I think that's a problem. We need to expand the benefits of the Affordable Care Act to everyone who resides in this country. Number two, and this is a smaller one, but it's important, we need to be able to move the open enrollment dates. Just like you have when you file your income tax and you say, hey, wow, I can invest in my IRA now in April and get credit for last year. What happens today is someone realizes, oh, I'm not in health care, I pay a penalty for last year, I want to enroll right now, but the window's already closed, so they know they're going to be paying a penalty this year. They won't have until the end of the year to get right. That's a smaller fix. We should be able to find bipartisan agreement around that one.
Just a quick comment about the coalitions. I mean, the one thing to remember about the passage of Obamacare is that, if I'm recalling correctly, there was like almost zero Republican support to get that bill done. So President Obama reached out to the Republicans. In fact, he spent months trying to encourage them to support or even put something on the table to move the thing forward. They refused to do it. So eventually he said, look, I've got a Democratic majority in both houses. I'm the president. Let's move this thing through. And thank goodness he did, because now we've got 17 million additional people who have insurance. There are 30 more million to go, so we've got a ways to go. As Mr. Brown mentioned, there are large groups of people we still need to reach. But it wouldn't have happened if he hadn't decided to move forward in the way that he did. I think we ought to continue trying to reach out to the Republicans and see if we can build some kind of coalitions. But as was mentioned earlier, all we've got through the House of Representatives, which is where we're looking to run to go, what the Republicans is charged, is 62 votes to repeal Obamacare. No amendments, no effort to repeal or to reform it in any way, no compromises proposed. They just keep voting to, even though they know it's not going to go anywhere, they just keep voting to repeal it. And the last time they did it, they got it through the Senate as well. They sent it to Obama, he had to veto it. So, as long as we're looking at that kind of environment, let's be serious. The only way to move it forward is to expand the Democratic Party coalition in the House and the Senate to make it happen. And definitely have to hang on to the White House. I think it's critical to,
I agree when I listen to what we're saying here about it. Definitely, the Affordable Care Act is probably one of the most, when you look at what it has done to this country, so many people that needed health care, it's revolutionized the healthcare industry. But when we look at, again, the opposition that the president has gotten, and we're looking at this divided Congress, we have to understand that whoever you elect, ladies and gentlemen, is going into a very hostile environment. And I keep saying it over and over again. And if President Obama, and I heard one legislator on the Hill, he said, President Obama rammed health care down our throats. That's almost the way we have to go forward. It's sad to say that today, but you need somebody that's going in there, it's going to be strong, and it's not going to compromise your issues, because that's why we're at the bottom of the ills list today. A lot of the issues that we got going on here is because people got up in here and tried to, well, let's compromise, let's negotiate, and we wound up with nothing. So I'm saying yes, the Affordable Care Act there needs to be some massaging to it. It's a lot of areas, but we talk about people having health care. I think the biggest thing was having our children to be able to stay on that health care until they're 26 years old. That was a big, and trust me, all Americans, even the ones up on the Hill, are taking advantage of that. So we have to understand, certainly health care is here, as far as I'm concerned. It's here to stay. The President Obama did something good, but we got to deal with that repeal and constantly be hearing about repealing. Thank you.
One thing that I'd just like to clarify that was brought up earlier, the Affordable Care Act was passed with 0 Republican votes, but not with 0 Republican input. They actually added what they thought would be a poison pill. They thought if they added this, Democrats would never vote for it. Members of Congress are required to purchase their health insurance on the exchanges. They didn't think that would ever fly. They added it, it passed, that's the current requirement. At the same time, I think that the Affordable Care Act is more of a transition. It did a lot of good work in getting rid of the worst abuses of the insurance industry, but as I mentioned earlier, I'm a big fan of the idea of a single-payer healthcare plan. I don't think that people should refrain from going to the doctor because they can't afford their co-pays or because they can't afford their deductibles. I don't think that people should wait until things are emergencies before they get the care they need. I don't think that people should say, I don't want to take the ambulance because I can't afford that bill. I think that if you want care, you should be able to get care. I mentioned that I've been the beneficiary of the VA healthcare system. And one thing that I noticed that was very different with the VA as compared to the private industry is that I was never once told the VA won't pay for that. The focus was always on figuring out what the problem was and making sure that I got better. And I believe that all American citizens deserve the same thing. Thank you.
I would fight to make sure that the Affordable Care Act is not repealed. The Republicans have tried more than 63 times to repeal it. And I can tell you, I sit on the Health and Government Operations Committee, and the Maryland Health Exchange was created in my committee. I voted for it, I worked hard on it. And I can tell you that prior to the implementation of the health exchange in Maryland, our population is 5.9 million people. We had almost 14.2% of our population was uninsured. Since we expanded Medicaid and we created the health exchange, we have covered over 450,000 people in Maryland that did not have health insurance. So you bet every dollar you have that I will work hard to protect it, because I know, I have been on the health committee for 9 years, how it has benefited people in Maryland and how it will benefit, America. And before we created Obamacare, we had 47 million people in the U.S. that did not have health insurance. What we need to do, though, is that we need to make sure that the Cadillac tax is repealed, not just extend the time, like they're talking about 2 years. Because the Cadillac tax places a 40% excise tax on those employer negotiated health plans. And it is not fair when a union like AFGE that has negotiated for their members a certain plan, that now they have to pay taxes on it. Thank you.
Thank you very much for answering that question. The next question, we will begin with Mr. Anthony Brown. The question is, National Active Retired Federal Employees, NARFE, supports the repeal of both the windfall elimination provisions and the government pension offset, which were amendments to the Social Security Act. Because of these provisions, many federal retirees covered by the Civil Service Reform Act receive no or reduced Social Security benefits. Please explain your position regarding the repeal of both the windfall elimination provisions of the government pension offset.
Sure, and let me explain it. I'm not so familiar with the details of those bills, but let me explain by analogy with the Department of Defense disability retirements and Veterans Affairs benefits. It used to be the case where if you were eligible for benefits under one, and then you became eligible for benefits under the other, they would offset and it would reduce your overall benefits. I never supported that. I had the opportunity to co-chair the Obama-Biden transition at the Department of Veterans Affairs. One of the first pieces of legislation that the president put through, which I supported, not as a member of Congress, but certainly as a veteran and an advocate, was to eliminate that offset, which we've done. We ought to do that as well. If you're eligible for benefits under one system, and then you become eligible for benefits under another system, I don't believe that they should be an offset. So that's kind of where I am on this particular offset. So certainly I would be supportive of eliminating the offset in the context of what you offered in this question.
Yeah, I think it's important to not penalize people for being part of the system where they're getting some benefits, but take away their Social Security opportunities or benefits as well. So I would definitely support an effort to repeal any kind of penalty for people, federal employees, retired federal employees who are sort of confronted with that situation, because I think it's unfair. And again, it's for people who need sort of multiple legs of the stool to make sure their retirement works for them. We don't want to take part of it away or penalize federal employees in that way.
I agree 100% that we wouldn't want to penalize federal employees in that system, but that's something that I probably have to study up on a little more to really understand all the real details of it. But definitely when you start talking about penalizing federal workers because they want to change I just don't think that is the right way to go.
I think this in particular is one issue that you're not likely to see any daylight between any of the candidates up here. I believe that if you have earned your benefits, you shouldn't be penalized because you've earned more than one type of benefit. And I definitely would support the repeal of those provisions.
I will support the repeal of those provisions. I know that if you work 30 years or more, it won't affect you, but it's not fair to those that work less than 30 years. And I agree with everything that has been stated.
our federal employees, I mean, we consistently see that, whether it is transportation and subsidy benefits, whether it is Social Security, whether it is payroll tax, or whether it is transportation and Medicare, or dental and Medicare benefits. I've been a federal employee, and I am not in any way in support of provisions like the windfall tax. I support the repeal of it and any other provisions that would cause a degradation or to set aside, or to cause federal employees to have a greater burden on trying to provide for their families.
Thank you very much. I'd just like to encourage all of you to find out more about the windfall elimination provisions and the government pension offset, because that's something that really means a great deal to federal retirees. On to the next question. Some candidates running for office of President of the United States have indicated that they plan to reduce the federal workforce, and some have even said they are going to immediately eliminate certain federal agencies. Please tell us your position regarding such reductions or promises of reductions.
Well, I mean, this is, I sort of alluded to it in my opening statement. I mean, it really started in 1980, and it's sort of grown into this starve the beast approach that the Republican Party is pushing. And by that I mean they just want to cut the federal government, cut the federal budget. That's how we got sequestration, which is just an insane way to run a government. They want to cut everything across the board, no matter whether it makes sense or not, whether it's a program we need, whether this is a good program or a bad program. That's how we end up with sequestration. I think it's the wrong way to go. I think there are cuts that we could make, in efforts to reduce some of the burdens and expenditures that aren't working out. Any waste, fraud, and abuse, I think we have to make sure we work to address that. But I think it's critical to challenge the view that there's something wrong with the federal government. As a matter of fact, it's completely the opposite. The United States federal government is one of the, if not the best in the world. I've got a daughter who's working for UNICEF in Africa, and seeing what she goes through in dealing with those governments really is a powerful reminder of the outstanding work that federal employees deliver, the outstanding services that they deliver to really help the United States work in the way that it does. So I think we have to stop trying to vilify federal employees, stop trying to attack them, stop trying to cut the benefits to discourage them from going into the government or staying into the government. We need to give them the COLAs and encourage them not only to come but to stay. And I'll stop there.
Certainly when we, can you hear me okay? Certainly when we talk about cutting benefits in the government, there are some places we need to cut. There are some places that aren't working the way they should. I could probably name some of the agencies, for example, like the EEOC. I know that's not working the way it should, and we definitely need to do some things with that to fix it. But I don't think just slicing and dicing the way the Republicans have presented this is the right way to go. Clearly, when we talk about waste, fraud, and abuse, there is a lot of that going in the government. I remember when I was working for my agency, we used to get to the end of the fiscal year, and they said, look, just buy everything, spend as much as you can, because we don't want to lose money when we get our budgets assigned to us next year. We don't want to lose money. That's crazy. So there are a lot of things that needs to be fixed in the government, but just slicing and cutting and dicing employees, no, I think there's another way we can handle it. That's something that we would need to look at. But waste, fraud, and abuse is a big problem in the government, and making agencies do what they're supposed to do, that's what I'm a proponent of.
Well, I think one big problem that we have is we have Republicans who don't believe that the federal government has any business doing anything. I think we have a lot of agencies that they try to cut that are already understaffed in order to do the jobs. You look at the EPA's lack of enforcement power because they keep having their staff cut. When I was working for the Census Bureau, we kept having reductions in force, and we've had to delay the release of some of our publications. We've had to delay the the rollout of the 2020 decennial, because that's a several-year process that kind of ramps up over years. It's a cyclical process. So I think that each federal agency, we need to identify how many employees they need to do their jobs, and for most of those agencies, that's an increase over where they are now. And if there are agencies where, where there is waste, I think we can identify that. But as a whole, the scope of the federal government is not nearly, it doesn't have enough employees to do the job it's already supposed to do. So the idea of cutting it only comes from the idea that the federal government shouldn't be doing anything. And I strongly disagree with that. Thank you.
Can you imagine getting rid of the Department of Education, the Department of Commerce, the Department of Energy, the Department of Housing? I mean, that is what they're proposing. And the Environmental Protection Agency. Who's going to oversee all the laws? Think about the Department of Education, for example, the Pell Grants, federal student loans. Who's going to provide those? It will be a disaster. And I would fight against that. It is absolutely not right for them to be able to propose that because we need to protect the environment. We need affordable housing. We need to make sure that our kids have money to go to school and get an education. It will be a disaster, and I know that some of the Republicans, that is what they're putting forward. And I will be an advocate to protect that, just like I have been for 9 years at the state level, fighting to make sure that we protect our departments. Now, if you have waste, like it's been said, or fraud, then fine. But if it's not broken, don't fix it. If it's not broken, you don't need to fix it. Thank you.
You all, I want to stand up here and tell you that everything is great in the federal government, and there's no need for us to do anything. Just let's roll as it is. But I've been an executive in government, and I know that we have serious management challenges in our government. So I want to make sure that, number one, we are holding people accountable, starting with our senior executive corps and on down. We have to make sure that we're providing our workers with the career development and with the retooling that they need to offer the best government, good government, to the American people. I do believe that there are opportunities for us to streamline programs under the Department of Defense. I do believe, I'm glad that the President very recently introduced the Every Student Succeeds Act, which primarily remands many of the education responsibilities, especially when it comes to testing, back to the states. I believe that is seriously a state issue. I do believe that in our agencies, I fully support that the government plays a role in all of our lives, and we have to make sure that we're fighting and protecting the very services that our federal government provides. That, seriously, though, comes with a tremendous amount of oversight and responsibility and accountability. And so while I don't want to fire anybody, I want to make sure that people are trained and tooled to do the job, to deliver good government. But I am also about 100% accountability to make sure that our tax dollars are spent adequately and appropriately, and we are truly delivering the services to our American people that they deserve.
It's interesting, you mentioned the question, presidential candidates. We're talking about Republican presidential candidates that are calling for the reduction and the elimination of agencies. Those Republican leaders are actually out of touch with their own Republican members. Because the Pew study did a research recently and found that the majority of Americans, and not just Democrats, are not calling for smaller government. They want more effective government. They want more effective. And the way that we deliver more effective government is not by starving agencies, it's by investing in agencies. It's by making sure that we've got competitive pay. So we know that we've got it's about 11% pay disparity between the public sector and the private sector, so we have to boost pay and compensation for our public sector, our federal government employees. It's investing in training, ongoing training for our workforce, good supervision, good technology, good workplace environment. When we invest in federal government agencies and federal government workforce, and we continue to improve the delivery of services and programs, then we address the real concerns of Americans. Americans don't want to reduce government. They want effective government. And there's a lot of effective government, and there's some ineffective government. And interestingly, probably where the most ineffective government is where we've outsourced it. When we outsource, and go to private service contracts, particularly the DoD, you see the largest fraud, abuse, and waste. So bring it in-house, invest in the workforce, and I think what you'll find is that Americans across party lines will say, I like that.
All right. Thank you very much. Mr. Paul, what, if any, specific changes do you favor being made in the U.S. tax code?
I believe we should eliminate the IRS. I think that when we look at it, and actually the tax code is so complicated in America. When you're talking about I guess really overall, we should reduce I think the tax code, when you talk about lower income people who make the lowest money in America, I think their taxes should be reduced. I think we should look at the folks that are making millionaires, people are making, like we talked earlier about $250,000 above, should raise taxes on them. I think that's the biggest thing, is really who's paying the bulk of the taxes in America and how is that hurting us. Certainly coming back again, in my little bit of time left, I want to say again, what we're saying to you here, and all of us, and all of the great ideas we have here. I think a lot of this has been said before, even by the other legislators that are up in Congress. But why isn't stuff getting done? And again, it's because we got to really understand we need somebody to go up there and be forceful to say, we're going to cover this district, and if this district isn't treated right, then certainly our voices will be heard. So that I want to keep reiterating that, because I know we all got great answers up here, but what will we do when we get in Congress? Thank you.
One thing that I always find a little bit ironic is Republicans keep talking about bringing us back to the 1950s and all kinds of different areas. You never really hear that when it comes to the tax code. They don't want to go back to 1950s taxes. And I don't advocate anything that extreme, but I do think that our tax code needs to be more progressive than it is today. If you have people who are making, $10,000, $15,000 a year, when they pay taxes, we are literally taking food out of their mouths. When somebody who makes, $20 million a year pays the same income tax rate as somebody making, $500,000 a year, that's also not right. So I think we need to take a good look at not only the rates, which I think 30 years has shown that trickle-down economics doesn't work, never trickles down. I think we need to start rolling back some of those policies that have been really detrimental to our economy as a whole. And that's going to mean increasing rates on the higher income levels, but it also is going to mean revisiting some of the deductions that people and corporations are allowed to take. I think if you have a private jet, you shouldn't be getting tax deductions for that. If you are outsourcing your work to other countries, you shouldn't be getting a tax deduction for that. So I think there's a lot that we need to look at and revisit. Thank you.
I think that I would want to work on the corporations that are going offshore and are not paying taxes in the U.S. because of our tax laws. We need to do what President Obama is actually suggesting, that we give them some type of incentive to bring them back home so that we can have that money. We could do a lot with that money, whether it's invested in education or in our infrastructure. The other issue that I know personally that I would like to change is the alternative minimum tax. My husband and I get hit with that all the time, and we don't know why. And when you call them, there's no explanation why most of us, a big number of people get hit with it. Also, I would love for our tax code to be simpler, more transparent, not as complicated, and more progressive as well. Thank you.
I would just tell you, the tax code, as all of you all might imagine, it is extraordinarily complex. And when we think about the so many different tax codes under the tax code, whether it's for corporate taxes, whether it is for Medicare taxes or payroll taxes, those provisions are extraordinarily complicated. But there's some basic things that I think that we can do. I would like to explore, and I want to emphasize explore the opportunities for a flat tax. But I also want to explore and investigate to make sure that the wealthiest of our Americans that are benefiting from the infrastructure and benefiting from the American way of life, that they are absolutely paying their fair share. I also think that we have to ensure that when it comes to small businesses, when we are providing subsidies to the oil and gas industry rather than to our small businesses that are trying to be entrepreneurs to create jobs, we have to make sure that we are providing some level of tax release or tax incentive or some level of subsidy so our small businesses can remain sustainable. So those are the areas that I would like to explore, but also to, as your representative in Congress, to really become a lot smarter and to investigate other ways that we can change the tax code to make it a lot simpler for all Americans, and we can clearly understand. And I believe that may be through a flat tax for all Americans, ensuring that the wealthiest of Americans pay their fair share.
Let me start by saying that we need to raise revenues in this country. We are a wealthy nation that underinvests in infrastructure and in education. This is an exceptional country. It's a wealthy country. And there should be those in our country who should pay more. So I support a progressive income tax as well, where we raise the top rates for the wealthiest Americans. I've met a lot of them. I'm not one of them. I've met a lot of wealthy Marylanders who are actually okay with raising the income tax because they know that you can invest in education and it helps their workforce, it helps their companies. You can invest in infrastructure, so when their company relies on moving goods and services on rail or road, a better infrastructure lets them do it at a lower cost. So there are wealthy Americans that actually accept that. I think we ought to raise the highest rates. I think we need to raise the rates on corporate income tax. And let me explain this. I know there's one school of thought that says if you do that, they're going to go offshore. But there are proposals in how you can raise the income tax on corporate profits and not encourage them to move offshore. And you do it, I don't know the full mechanics, in that when that profit is transmitted to shareholders, because the shareholders are us, and we're not moving offshore because our profits are being taxed. So I want to increase the corporate tax, I want to increase the personal income tax, but the other thing I want to do, very specific proposal, I want to expand the earned income tax credit to Americans living in poverty, even if you don't have children. A poor man, a poor woman without children should also get an earned income tax credit to help lift them out of poverty. So those are three things that I would be looking at to reform our tax code.
Yeah, I think a lot of what you heard makes a lot of sense. Just a couple of particulars. I mean, for example, I think targeting small businesses with tax cuts really makes sense. I'll give you one quick example. For a business that makes a profit, I ran into a small business owner actually in Annapolis, and he said, you know, if I keep the money, I don't get taxed as much as if I put the money back into the company. So I want to expand my business, but the tax incentive is to not expand my business and just keep the money personally and sit on it. And to me, that doesn't make any sense. So that's one of the types of changes I think we can make, not only that would help the small business owner there does actually less well personally, but would help the business and then help the community, because small businesses account for the vast majority of the increase in jobs here in the United States. And we definitely want to target small businesses. For larger corporations, I think the offshore piece is a critical part of it. It's a very tricky issue because we tried to do it before and they just found a way to keep the money, basically. So I think we want to do it. We're going to have to be sure that the way we do it actually gets them to bring back the taxable part here to the United States, so that we get to benefit from the taxes as opposed to it being offshore. I think also targeting tax benefits to individual families. So not the trickle-down piece where the wealthiest people get the tax cuts, for example, a capital gains tax cut. I don't think that works so well anymore, especially since now they send the money overseas frequently, or they invest it in companies that have it overseas. We want to target it, I think, on middle-class and working-class families so that they can spend the money here in the United States and benefit us.
All right. I really want to thank our timekeepers over there. They're waving the flag. It's up to you to see that you look at the flag. All right. Now, this is one that I want to going to explain a little bit about it before I ask the question. The Affordable Care Act removed most of the barriers that prevent people with pre-existing conditions from having reasonably priced health insurance policies. Today, billions of Americans, in fact, there are over 7 million Americans who are receiving Medicare benefits because they are disabled. The Social Security Act provides that if you're getting disability benefits for over 2 years, you then can qualify to get Medicare benefits. However, those same individuals cannot qualify for Medigap policies because they're not yet 65 years old. So there are over 7 million Americans today who are disabled Americans, receive Medicare benefits, but do not qualify for Medigap benefits because they are not yet 65. What, if anything, do you propose as a solution to this dilemma?
Well, the first thing I would say is that makes no logical sense whatsoever. I wouldn't put an age limit on those policies. I would say if you are receiving Medicare benefits, you are eligible for those policies. But also I'm going to go back to the fact that I do advocate for a single-payer healthcare system, which, if implemented and done correctly, would eliminate the problem entirely. So I think the more people that we can make sure have access to quality healthcare that they need, and aren't going bankrupt from seeking that care, because medical bills are the #1 cause of bankruptcy in this country, and that's even for people who have health insurance. I think the more that we're able to get them the care that we need, that they need, the better off we're going to be as a country, and the less lost productivity that we're going to see from people waiting too long to get that care.
It doesn't make sense. They're disabled to begin with. Okay, they qualify. That is the test. And in order to have a disability, you have to go to a doctor. They have to certify you are disabled, and you start getting the benefits. And there is currently a limit on the amount of money that a disabled person can earn, which is $2,000, which is nothing. I know in the state of Maryland, it's interesting you asked that question. We had a bill this week that I got up on the floor, as well as the chair of the Public Health Committee. It's called the ABLE bill, and it's a bill that would allow disabled individuals to be able to open something similar to a 529, and to be able to save money and put money in there for their expenses, and they'll be able to deduct it from their, whoever contributes, from their income tax. So I would say I would author a bill that would change this. I would go ahead, that would be one of my first bills if it hasn't been done, or I will work it with someone else in order to change that policy, because it makes no sense whatsoever. This is not someone that is going to be able to work and make a living. It just makes no sense.
Ma'am, and again, I want, because it's a tremendous amount of my experience, and I'm very familiar with it. In the VA, I'm a service disabled veteran. And because I am a service disabled veteran, I have lifetime benefits under the Veteran Affairs Administration. And so I want to make sure that we're expanding those sorts of programs. The bureaucracy of our government is exacerbating. Like we spoke about the tax code. What I want to do is, as your servant leader in Congress, to leverage my experience to negotiate through the bureaucracy of our government. And it is overwhelming at times. And so, simply put, as our veterans, regardless of their age, are allowed to have medical benefits based on their disability rating for a lifetime, we have to expand that to ensure that all people with disabilities have the medical services and have the benefits and the requirements that they need to live a life of dignity and respect, a quality of life that they have either earned or that they have fought for. And so it is very simple for me to make sure that we are expanding programs that already exist to 7 million people. That is not a lot when it comes to what we're talking about here. We're talking about people with disabilities that don't have the opportunity to go out and work and be income earners.
again, I don't think you're going to see a lot of daylight between anybody on this this panel here. You know, health reform is an ongoing process, and it's not likely that we'll ever really achieve perfection. And as we are improving the health delivery system, the health financing system, and we identify problems like are presented in this question, it does beg for the single-payer system. It really does. But like Secretary Clinton, I think that I don't think we can scrap our current system for a single payer. But you can be assured that I will support and champion legislation that eliminates this problem in health coverage. 7 million people. It's not consistent with, I think, the trend, the trajectory that this nation is on, which is eliminating the barriers, opening up the opportunities to expand health care, whether it's Medicare, Medicaid, you've got enhanced Medicaid, improvements in the VA system, the improvements that are necessary. We talked about it earlier in the Affordable Care Act. So this is yet another example of the need and the recognition that reforming health care is an ongoing process. I can easily see myself not only supporting, but and advocating, but taking a leadership role on addressing this issue.
Yeah, I think you're going to hear a lot of the same, I think. You know, there's an effort to try and make sure that more people get the coverage and protection they deserve and have earned. I think just generally speaking, this question and some of the others that have come up this morning point to the need to rationalize benefits that are available across the board. And this is certainly one of those instances. You know, the Medigap piece was actually aimed at trying to address this kind of issue, and you know, there are always unintended consequences. This is one that needs to be addressed. I just would say generally too, and I think that it's, you know, until we get to the point where we sort of rationalize more about the government and the bureaucracy, you know, the constituent services piece that our offices could provide is a critical aspect of what would need to happen. And by that I mean, people have these kind of issues all the time, and it might be veterans benefits, Social Security, the like, you know, IRS, whatever pops up. And I think it's critical for the congressional office to have available people on the staff who are familiar with working with that particular part of the bureaucracy, know how to help guide our constituents through it, so that they really have a chance to get the benefits that they need. Sometimes you even have people who get to the point where they have to go out and try and hire someone to help them do it. That doesn't make any sense. And I think this is one of those instances where, until we get to, whether it's single payer or something less, until we get to that point, it's going to be important for us to be able to provide the type of assistance and guidance that we can to our constituents to manage these processes.
Yeah, I agree. Again, we sit in the bed, we all agree. We try to say, okay, well, when you talk about Medigap, I mean, it doesn't make any sense that if you got a disability, you should be able to take advantage of that program. Again, we're talking about healthcare. Healthcare is a very complicated issue in America. I'm not telling you that. I mean, that's why we're saying President Obama did something that was catastrophic when he got healthcare through, because we had so many presidents that had tried it and just couldn't get it done. So that was a start right there. But when you start talking about Medigap, Medicaid, Medicare, and the issues that are facing America, we got 7 million people out there. Anybody that can't take advantage of health care where it is, they have a disability, they have something that involves with Medigap would cover them. It's a no-brainer. Again, though, what would we do when we got to Congress? How could we be a strong voice and make certain that things like Medigap and these other issues when it comes down to health care, you know, who are we? How, you know, what is our fortitude? How do we make certain that when you vote on us, we're going to go up there and we're just not going to sit there and just talk about it, but we're going to get something done. And clearly I would be 100% behind legislation to make certain that we clear this up.
Thank you very much. As I hear you talk about a single-payer healthcare system, and I think about some of the debates I've seen about Medicare for all, I'm thinking about our NARFE members and retired members who are indeed covered by Medicare. Many of those people have additional plans through Blue Cross Blue Shield and other health care providers through the Federal Employees Health Benefit Plan. because Medicare has large deductibles and Medicare does not cover everything. And so then I'm asking you, if we had a single payer health system, what happens to all of those insurance providers that are now a part of the Federal Employees Health Benefit Plan? Jocelyn, we're going to start with you.